I hope you will take a look at what's on your table, which is an announcement for another event we have in April. I say we are the school with the unusual name. We are going to be leaning into and celebrating the fact that people don't always know what our name means. With an event in April, we're going to be celebrating the School of Social What. We look forward to potentially joining us at that event. Today's event, though, is one that we are fortunate to have sponsored by our Changemakers group in the School of Social Ecology. They are the premier annual support group for the School of Social Ecology, providing funds for scholarships, for other student activities, for events like these. If you want to learn more about Changemakers, please, again, look at the information on the table, talk to any one of us, because they are the group that helps us do all kinds of things. If you care about solving problems in your community, you need to be part of our Changemakers. If you care about sustainability and helping that, address that in the community, Changemakers is for you. If you care about making the world a little bit safer, Changemakers is also for you. It helps us to do so many things. And we do really cover a lot of ground. Last year, UCI did a poll of members of Orange County, asking them, what is the #1 problem facing the county? Well, #1 was housing and affordable housing and homelessness. And it went down from there, and the first 6 issues were ones that we covered. But one of the issues that was not mentioned, but ought to be at the top of the list, is the crisis in mental health. The problems we're seeing with anxiety, depression, and other mental illness in the community. And this was really brought home to me in a conversation, a very personal conversation, a few weeks ago. I was talking to a friend of mine who lives out east. We hadn't talked to each other in probably a year or so. And I was asking him how things were going. And he paused, and I could tell something was up, and I said, really, what's going on? He was telling me that his 6th grade daughter had recently threatened suicide, and that it had gotten worse and worse and worse, but that they were able to intervene. They were able to use school counselors. They were able to use mental health professionals. They were able to get her the kind of help that she needed to be able to prevent something even worse. And I was saying to him, this really must be just an absolutely horrific period for you and your family. He said, it is, but that they were comforted by the help they were getting. And they were very concerned about the fact that there were so many other people they knew that needed that help and they weren't getting it. And what he said to me is what this country needs right now more than anything is we need a mental health force. Well, I am pleased to say that today we have 2 people who are very much addressed those problems here to speak with us. And both of the institutions that they represent are ones that are very concerned about those issues. We have Marshall Moncrief, who's the CEO of Mind OC, and Professor Schiffman of the School of Social Ecology. They are both leaders in this area. They are both committed to addressing the mental health crisis, and they both help to lead institutions that have as their mission addressing and helping all folks, especially children, with these problems. Marshall Moncrief, since 2019, has been the CEO of Mind OC, which is a nonprofit organization that many of us know, which was created to advance community-wide mental health collaboration. The one we know most commonly as Be Well Orange County. Be Well OC operates under the idea that a healthier Orange County begins with mental health services that address the needs of the entire community. Now, this is only scratching the surface of what Marshall has done. He's been a former commissioner of the Orange County Commission to End Homelessness. He's a licensed psychotherapist. He holds an executive MBA in healthcare management. But most importantly, from our perspective, he is one of our alumni. He is a graduate of the University of California, Irvine and the School of Social Ecology. And he is the first alum to speak in Daybreak Dialogues. So if nothing else, we would take great pride in having him here today. We also take great pride in Professor Jason Schiffman, who joined us not too long ago as the Professor of Psychological Science and the inaugural Director of Clinical Training for Social Ecology's Clinical Psychology program. Jason also serves as the Director of the Prevent Lab. The lab is dedicated to producing meaningful and useful research, providing person-centered clinical services, and training future leaders in psychology, many of whom you will see seated at the tables today. Jason has a PhD from the University of Southern California, for which we forgive him. And his research seeks to refine the identification of young people at risk of psychiatric disorders and better understand the effects of psychosocial interventions for adolescents with psychosis and uncovering mechanisms that can reduce stigma against people with serious mental health concerns. Both of them have tremendous backgrounds and bios. I think having met them both, getting to know them over the last year, what I can tell you is the most important thing is both of them care deeply about these issues and are committed to trying to make things better. For that and many more, I thank them very much and appreciate their being with us today. They'll be up here in just a moment. The format for today is that they'll each be speaking for a little bit. There'll be a conversation between the two of them. At some point, I think they will get tired of hearing each other talk and turn to you for questions, and I promise we will have you out of here by 9 o'clock and able to move on to the rest of the day. So, without further ado, if I could ask the two of them to please come up here. Please welcome Marshall Moncrief and Jason Schiffman.
I think you're, yeah.
Has my mic been on the whole time?
I'm hoping not, because I went to the bathroom.
I was thinking the same thing. Morning, everyone. So, John, thank you so much for the warm introduction. I will say that one thing that I know for sure is that both Marshall and I do care deeply. And where are you, John? Oh, and we know that you do as well. And I think that synergy and partnership really helps us reach for our highest potential. Marshall is not just a colleague, but also a friend. Sometimes we refer to each other as brothers from different mothers. But we have a unified goal of helping the state of mental health for people in our community. And one of the things that I was thinking about when we were invited to speak here and just looking out in the audience is that although we have some background and some expertise and are trying to do things that matter and make a difference, any one of you in the audience could be up here leading this conversation because all of us are impacted by mental health in unique and sometimes challenging ways. So hopefully by the end of our time together, there'll be opportunities for you to contribute and to share your ideas and allow us to learn from you as we try to do the same. So the last thing I'll say for introduction is that this backdrop is from Hawaii. So this is the beach in Waikiki, where is the place where I started my career as a professor at the University of Hawaii in 2003. And the thing about Hawaii, in addition to the beaches, that was so special is a sense of community. And I think there are aspects of our UCI community and our Orange County community that bring people together in ways that are very similar to how it is in Hawaii. And you all taking the time to come here at 7:30 in the morning speaks to that and speaks to our ability to do more collectively than any one of us could do on our own. So that's my opening remarks, my friend. Anything you would like to say before we go into slides?
I guess just thank you to John and the School of Social Ecology for allowing me an opportunity to join you guys. Jason, myself, Dr. Kelly, others, we give a lot of talks on some of the stuff you'll hear about today. But John, some of your opening remarks just caused me to pause for just a second and think, and I'll share with you. I think what's exciting about what's happening in Orange County right now and what's exciting about the potential of us as a community is Orange County is the 6th largest county in the country. And at the same time, we kind of all know each other. And so there's still this intimacy to Orange County in a really unique way. And so if there was any community in the country that I'd want to be in right now to address the mental health challenges in a robust community-wide way, it would be Orange County, because we're small enough to manage, but we're big enough to matter. And so pleased to have the opportunity to share with you some of the stuff that's going on in this community and hopefully continue to broaden a community-wide coalition. So thanks for having us here.
Excuse me. All right, so
Where do you want me?
I don't know.
I'll just hang
We've
out
not done
here.
this before.
Yeah.
But you lean there.
All right.
All right. I might walk around a little bit, but here's what we hope to talk about. So we want to just set some framework for the notion that there are mental health challenges in our community and in our country and in our world, with some basic statistics that we picked to illustrate the point. Then I'm going to turn it over to Marshall to talk about a potential solution. In that Be Well OC and Mind OC are working to create a more seamless path for mental health care. Then he'll kick it back to me, where I'll talk about the psychological science department and how we are trying to bring science to solutions to make the world better through our ideas and pushing our ideas out into the community to create change. And then we'll just open it up for discussion and listen and learn. So mental health pandemic. We see that, like few cherry-picked statistics, 4 in 10 adults now report having anxiety and depression. Similarly, for kids, teenagers with persistent feelings of sadness or hopelessness, 4 out of 10. 1 out of 5 young people seriously consider death by suicide. Particular red flags to be on the lookout for: youth who are black and young adults who are black, teenage girls, and members of the LGBTQ plus community. Marginalized members of our society are experiencing double marginalization. First opportunity for us to have a dialogue or a conversation. If this is an opportunity for you to get your phones out and the speaker won't be annoyed. So if you take a clip of that, it'll open up a Menti. And then the question that the Menti poses is, what's causing the mental health crises? So take a look and then enter some things, and I'll present a word cloud. All right, so you'll see it's sort of dynamic. Some things are, stigma looks like it's right in the heart of it. But other things that are very discombobulating to read at any one time continue to grow. The pandemic looks at stress. And then I like to look at things on the margins too, like family stress work or competition, education, greed. But you'll see a variety of different factors here that are contributing to challenges related to mental health, and that are contributing to a mental health crisis beyond, I think, what's been typical or what's been seen even before the pandemic. Some other things here: self-esteem, COVID gets up there, work, discrimination, burnout, inflation, income inequality. A variety of different stressors that we all feel and that we all know and that you all are contributing to bringing to the conversation. Anything else you see in there, Marshall?
Well, stigma for sure is right there in the center, and that's a big one. I saw one of them pop up. I'm not seeing it now, but it was lack of access. And so I think the words that really stick out to me are things that would be causal of mental health challenges. But I think one of the things we'll talk about this morning is system inefficiencies in responding to the needs. And so that becomes sort of a double-edged sword, is the rapid growth of the problem on the chassis of a system that isn't engineered at current state to be responsive to the size of that problem or the multiple manifestations of it. that
Yeah.
this is a very cool little app.
Yeah, it's cool, right?
Yeah.
And I mean, and the last thing I'll highlight isn't any one thing in particular, but it's the diversity of ideas and contributions here. There's a lot going on. And so there's not going to be one single unified solution for all of this, but being aware of the variety of different challenges and how they affect different people at different times can help us get towards a better path. Okay. All right. So a couple of things that we generated or brainstormed, very overlapping with what you all contributed. And I won't go over them, but I want to highlight that these factors contribute to mental health challenges and situations and circumstances that lead to reduced self-esteem, or mental health challenges related to depression or anxiety, perhaps stress that causes psychosis, hopelessness. Hopelessness potentially can lead to increased risk for suicidality. All of this is impacted by a lack of access to quality care, which is exactly what Marshall was saying. We have solutions for some of these things, certainly the mental health constructs in yellow, but lack of access to quality care is really dragging us down as a society. So what's sustaining the mental health crisis? Well, around half of people that have mental health care needs don't receive care, and that's probably an underestimation. Many folks.
Jason, would
Yeah.
you go back one slide?
Yeah, of course.
One thing I wanted to just call out is you see on the top bullet, pandemic. And so, you can hardly have a conversation without talking about the pandemic, talking about the COVID pandemic. And I think it's really important to highlight, so the COVID pandemic definitely had an impact on mental health, for sure. Prior to the pandemic, in this country, we considered depression, substance use disorders, suicide, and homelessness. Those four things all were considered independently as epidemics of this country prior to the pandemic hitting. And that's super critical, because the pandemic came through and certainly poured gas on the fire of those crises, but we were already in a tough spot in those four areas and related challenges around them. I think what COVID did was heat those up to such an exaggerated sense of crisis. And maybe the silver lining, though, is it brought to the forefront the conversation about these things in a more robust way than maybe we've had before. And so if there was a silver lining to that awful challenge, that might have been one of them. Because I certainly am seeing conversations much more broadly in community than prior to COVID around mental health. But those challenges existed before and certainly are bright now. One other COVID thing, if I could riff for just a minute more. So I've worked in the hospitals of Orange County for the last 20 years. And during COVID, all of my friends and colleagues and family who still work in hospitals today were in a major crisis that they'd never been in before, of concern about, are we going to have a bed available for the next person that comes knocking on our door for care? Are we going to have an oxygen tank for that person? That's in Orange County, California, in some well-resourced areas in some of the best hospitals in the country. And they were scared to death about access. That situation that they lived in is mental health care, always. Always. Are we going to have a psychiatric bed to get this person into? Is there going to be the right level of rehabilitative care for this substance use challenge that this poor person is struggling through sitting in our emergency department? That's always, pre-pandemic and now. And so the work we have to do is pretty significant. But again, if I was in any community in USA, I think Orange County is so well positioned to do this together. So thanks for that, Jason.
Yeah,
I just wanted to comment on the pandemic piece.
Absolutely. I mean, and the other thing, Marshall, that you're making me think about is, like, it's not just at the highest levels of urgency for mental health.
Right.
It's at every step. Every step there's deficiencies in terms of
Right.
serving the need. And Ronnie and I were talking about how students aren't yet, accustomed to working face-to-face with people because of Zoom. So, I mean, I witnessed people meeting each other for the first time in real life on Zoom. They were like friends from Zoom, which is cool, but we need like both, and like face-to-face really matters, especially when your urgency of mental health care needs begins to increase. So yeah, for sure, Marshall, thank you. All right, so a lot of unaddressed need. Here, these are just some quick statistics. Again, probably underestimations, but I found that 65% of psychologists have no capacity for new clients. And as just a personal anecdote there, as a director of clinical training at UCI, one of the most prestigious universities in the world, it took me 2 months to get my daughter therapy. And 2 months. And I have all of the privilege that anyone could possibly dream of to, the best health insurance, clinical connections. And I had to work with the schools to find the right person. And not even the right person, a person. And it couldn't be in person. It had to be on Zoom. So if I'm having that challenge, I know. And it wasn't, the stat here is about psychologists. This wasn't even a psychologist. And I'll explain more about that later. But I also want to emphasize that there's disparities in the amount of folks who have higher degrees that become therapists, most of whom are white, which further marginalizes already marginalized members of society. So there's a pipeline to professionalism, or to professionals issue that we have to address as well. So what's sustaining the mental health care crisis? I keep hitting that. A few things, some historical. So deinstitutionalization was this well-intended policy where folks were removed from hospitals, mental health hospitals, that really weren't providing adequate care. But the plan was to fund community mental health centers, which,
didn't save you from a broken ankle.
Thanks. Well, I'll just trip on the sand, which would lead to better care in the communities, but they were underfunded. So this led to people with unstable housing and not getting the care that they need. This is actually a picture of an institution that I used to work at in Maryland, at Spring Grove Hospital. Not enough providers, so we're already hitting that as a theme. But part of the reason why there's not as many mental health providers as there might be in other areas of society or in healthcare in general, lower pay, low reimbursement and rejected claims from insurance companies, and public and private. And this is leading to more people leaving the field than entering it. In fact, I have conversations with people in the mental health care field going to Google from like being therapists, which, to each their own, but like this is, the incentive structure is setting that up in that way, and I can't blame them. So we need to think through that more carefully, maybe not today. But related to that, mental health parity laws. So these laws were passed many years ago that said that mental health concerns had to be treated the same way as physical health concerns, which is a great thing, and everyone was so excited. I remember this at the time. If some of you are nodding your heads like, this is going, nobody cares about those laws. They're totally unenforced. So your insurance company is mandated to care for you in your mental health as they do your physical health, but the parity is not there and it's not enforced. So it's a main problem, although hopefully there'll be some movement in that. So a few other things, insurance panels. It's hard to, if you're a mental health therapist, to get covered by insurance or be on their panels. The list of, how many of you, by show of hands, how many of you like tried to call a mental health provider, turned your card around, or went on the website to try to find providers and like you couldn't find anyone? There's like 100 people on this list. I'm seeing some nods, like thousands of providers on the list, and not one of them is available or no longer takes insurance or doesn't see people in the age range that they said they did on the website. It's a mess. It's worse for mental health. Fragmented systems and silos, which Marshall is part of the solution around. And treatment not as effective as possible, which is something that I'm really proud about our psychological science department. Is we are on the cutting edge of making treatments better when they're implemented in the community. All right, so another mentee. Pull out your phones again if you want. This is about solutions. Now, as you're taking that picture and entering into that mentee, I want to say that it's such an honor to be on the stage with Marshall Moncrief, who I think is a national leader in solutions. So when we think about a mental health crisis and how to solve it, Marshall is one of the first people that comes into my mind in terms of how to make change and make it so upstream that we're affecting systems that then impact individuals. He does this by bringing people together and listening to others and hearing their ideas. So it's my honor to listen to you for a moment as we switch over.
Thanks for that, Jason, and then
Yeah.
we'll see what comes up here on this thing.
Yeah, let's do it.
I'm having so much fun watching how this thing works. Oh, yeah.
Hang on one sec. Care, that's a good one. Did everyone say care? There we go.
There it is. Greater access to care.
I see funding as a core thing, which is wise. Money drives. Awareness, care, peer support, empathy, training. You see some of the things on the margins there: insurance, legislation, increased awareness, embracing diversity. More education. Mind OC's up there.
Oh,
Did you write that?
yeah, right. Funding's an interesting one. I mean, it's for sure true. There was one in there, and I don't see it now, but it was action, and I love that. I like a lot of them. Mm-hmm. Action to me really resonated. Because it's not a total mystery what needs to happen. It's just really tough to get systems and structures to function differently than they're used to functioning. And so the second to the last bullet point that Jason had on that last slide was fragmentation and silos. And there's truth to fragmentation and silos. And Jason, you were really kind in the compliments. But I'll tell you the story of Be Well that we're going to share and the story of my role in it. Is it time now, or do you have other things?
It is.
Oh.
The slides,
Didn't go.
they got the wrong one.
Oh, got it.
So let me see.
That's all right. I can just swing it.
Uh-huh.
So the story of Be Well Orange County is, and the story of my role in it is less sort of romantic or something than maybe Jason was making it sound. The whole thing really emerged out of desperation. And so in Orange County, there was a long-standing conflict between hospital systems, between county systems, Medi-Cal payer, in Orange County it's Cal Optima, law enforcement, and all of us, I was in the hospital side of this for a long time, got really good at pointing fingers at each other to say, hey, what are you going to do about this big problem that's impacting us in our system? We got really good at that in the hospitals, in fact. Hey, Ronnie, hey, county, what are you guys going to do about all of your patients in our ER? And they got pretty good about pointing back saying, I don't know, it's your ER, what are you going to do about it? And it really, the conversation wasn't much more elevated than that for quite a long time. And I remember at one point, this is, I don't know, maybe it was 2017 or 18 or something, the ERs had about 20 to 25% occupancy of mental health, substance use, and homeless-related crises at any time across the board. The riverbeds near Anaheim Stadium, you'll remember, were filled with folks struggling with homelessness, a lot of them, most of them, with co-occurring mental health and substance use challenges. Our sheriff was out saying that the biggest psychiatric hospital in Orange County was the Orange County Jail. I was in Washington, D.C. for a trip with my daughter, and there was a national newspaper, and on the front page was Orange County and how we couldn't get our act together around these challenges, not exaggerating. So the way that sort of Be Well emerged was kind of desperation. There was a few people in a room. There was about 20 people that got together. It was county representatives, some elected leaders, some city electeds, chiefs of police and the sheriff, and some hospital executives. And we got into a room, and it was very organic. And the conversation began around, gosh, what do we do? We're pointing fingers at each other. Everybody's working their tail off, and everybody's drowning. What do we do differently than we've been doing? We got to be able to move the needle on this stuff. And I remember that very first meeting, at the very end of the meeting, somebody said, well, should we get together again? And everyone looked around the table. Yeah, let's get together again. To give you a sense of how organic this was not a grand romantic master plan. It was survival. Like, what do we do? This isn't working. So let's get together again, and we did. And 25 people became 35 people, and then we got together again, and that became 50 people. We got together again, and that became 100 people. And the room started growing, and we were calling ourselves the Coalition of the Willing. And everybody kept showing up. And after about a good year and a half of that, there was enough goodwill, and we were starting to repair relationships and starting to build trust and a sense of, hey, if we lock arms on this, we really might be able to move the needle in this community around one of the most vexing challenges in healthcare, and let's go for it. We had a slide here. I don't know that it's going to be available, so I'm going to walk it through. But I don't think it's necessary, but unless it's easy to pull up.
Let me see. You keep going.
Okay. That shows the way in which we were visualizing the current state of Orange County and the way in which we were visualizing our hoped-for state of Orange County and the roadmap that many people came together to create that would get us from one state of being to another. And so we'll see if Jason pulls this up or not, but I'm going to do my best to describe it. I used to have a slide, and it was just white. So imagine this is just plain white, and would describe the work that we put into articulating and drawing the system of mental health care in Orange County. And it was just a blank white slide. And the reason that little tongue-in-cheek thing was because there is no real system of mental health in Orange County. There's a whole lot of hardworking people doing a whole lot of good stuff. But from a system perspective, it's fragmented and siloed, just like that second slide. The county, and Ronnie, what she leads, is probably the closest thing to a system that we have, the county system, but it's for a very narrow scope of people who need that help desperately, and we're fortunate to have that county system. But if we look on the macro of 3.2 million people and the varying demographics of Orange County and the varying needs from mild to moderate to severe, we need a comprehensive system that's responsive to all of those people. In the early 2000s, we had world-class healthcare in Orange County, but stroke care was a crapshoot. So in the early 2000s in Orange County, stroke care was a relative crapshoot with respect to what would the training be from the ambulance driver that pulled up to attend to your needs, and what was the training of the medical team in the ER you were dropped off to? What was the training and the protocols of the physician that was treating you, and then what were the aftercare steps? It was a fragmented bunch of good efforts that wasn't very systemic or super responsive, and we didn't have great outcomes. The public and private sectors have worked together in stroke care now for a couple of decades in Orange County. If you're gonna have a stroke anywhere in the country, you're fortunate if you have it in Orange County, California, because the stroke system has now been created. We have an exceptional system for stroke care. If any one of us was to be having a stroke right now, the vast majority of the rest of us would probably recognize that that's happening because of the education that's been pushed out, largely through the county and the public sector, to all of us, as well as the hospitals. We would call 911, and there'd be an ambulance that would come to attend to us, and they'd all operate on the same protocols when they engaged. And they would take you to one of a few stroke receiving centers in Orange County, where every one of them, no matter which one you land in, operates on the same protocol. And your outcome would be extraordinary. And so that's the way we improve stroke care in Orange County. It was a public and private partnership, and the stroke system, when you look back at it, is all of these disparate pieces that work together seamlessly. So the hospital doesn't own the ambulance company, and in fact, they don't employ the doctor. And the aftercare system is probably separate too, but all of them work seamlessly to provide excellent stroke care. We need something like that in mental health. What we have in mental health, thanks for pulling it up. This is what we have in mental health today. All of these drifty flags, I don't know how well you can read them back there, but they represent the different sectors of our community. And so you have the faith community, the little plus sign is the hospitals, the clinical continuum of care. You have academia in there, you have social justice, you have housing. There's all of these different sectors of the community. And if you ask leaders in any one of those sectors about what are the top 3 challenges that hit you today, every one of them will have mental health in the top 3, for sure. I was surprised that in the Changemakers thing, it didn't come up in the 6 topics. Because if you ask a person of faith, either Rabbi Steinberg down the street or Kay Warren a little further south, hey, what's in top 3 challenges? Mental health, for sure. If you ask somebody who is at the university level, what are the top 3 challenges with your student body? Mental health, for sure. Law enforcement, private practice to hospital-based physicians, school administrators, elementary and high school, the same answer every time. All of them are trying to solve for the challenge through the limited resources and limited scope of impact of their specific sector, or even more limited, their organization within that sector. And so there's a ton of good work going on in Orange County, but it's all happening in these acupuncture-like pokes. And spread amongst them are the people that need help. And so some of those people are insured, some of them are uninsured. If they're insured, some are publicly, some are privately insured. Regardless of their insurance status, their clinical needs vary, mild, moderate to severe. All of those dynamics in that little image create a system where there's 1,000 different doors to access care, and you gotta find the right key to get into the right one. So Dr. Jason Schiffman, the head of psychology at UCI, struggles and trips and fumbles to get his daughter into care because there isn't a smooth system that's working in an integrated way. There's really hardworking, really loving, amazing people doing things independently. The outfall of that, if we're just to be sort of gross generalization, is that the crises in the community are increasing. We don't have a solid enough upstream approach. We've engineered a system in Orange County where law enforcement and EMS are the default response. And when you send out law enforcement and EMS to mental health and substance use challenges, you get a whole lot of people that end up in jails and hospitals. That's not a criticism of them. That's just what the tools that they have available to them. And so what we're trying to do, oh, I didn't know this. I forgot. I put a test in. I figured we're at UCI. We're not going to get through this thing without a test, a multi-choice test. So annual emergency department admits in Orange County. So because of this, how many admissions for mental health, substance use are happening in Orange County ERs every year? If you guessed D, you're right. It's 50,000. Having worked in that environment for a long time, I can tell you that a minimum average cost is about $2,000 an admit. So there's the annual spend in this community for wrong care, wrong place, wrong time, and less than optimal outcome, frustrated family members, frustrated patients. It's just not the right environment. So we need to do better. And one way that the Coalition of the Willing, the Be Well community, which is a whole lot of people and a dozen others, Ronnie herself could and should be giving this talk, is we want to take that left side and make it feel and function more like the right side. So we want to get the whole community to come into a more unified approach, a more integrated effort that wraps support around all of Orange County, regardless of what the person's insurance status is, regardless of what their clinical status is, mild, moderate to severe. That's the goal. And we think in Orange County, we're uniquely positioned to actually pull something like that off. And that if we did, we might even be a replicable model for other communities in the state. The way that we do that, and I'm going to try to track towards time here. I don't know if it's going on too long.
You're brilliant.
The way that we do that to get the left side to the right side is we created a blueprint, and it's relatively simple, and it's based around the collective impact model. And so we asked ourselves, and I really mean truly we, like the faith community was there, the schools were there, the public sector, social services and public health were there, representatives of UCI were there, and asked ourselves, if we were to succeed in this, if we were to have moved the needle, thinking with the end in mind, in what areas would we have significantly advanced the system? And the community came up with 6 key result areas: stigma reduction, prevention and early intervention, closing treatment gaps, strengthening our crisis response system, building campuses of care because we are underbedded in Orange County for crises, and then aligning policies, partners, programs, and data. So the way I kind of see it is we have some upstream-oriented focus, we've got some downstream-oriented focus, kind of an anchoring focus with these campuses, and then cross-stream is that light blue one. And an example of that would be the efforts that are happening in Orange County around homeless solutions need to fundamentally be connected to efforts in mental health. It's not always a one-for-one, but the overlap is significant. And then that little black dot in the middle, you had heard me, I play a role in a little organization called Mind OC. As we solidified this with the community, and at one point we had about 300 people, and I don't know how many organizations down at a conference, 2-day conference, to finalize this together as a community. The community was quite vocal in saying, this all sounds awesome, and we've all got full-time jobs doing this, that, and the other thing, so who's going to organize this thing and who's going to run it? And so the community called for the creation of a neutral nonprofit that would function like a Switzerland entity whose sole role was to advance those 6 results with and through community, to braid public and private dollars to get it done and advance the strategic initiatives of what we're calling Be Well Orange County. And the little gray dots represent all the individuals and organizations that currently do work in that space, that we were going to try to orient around certain initiatives. And so I remember one of the big churches saying, Marshall, this is really good, but gosh, we've invested so much in stigma reduction. Does this mean we have to kind of get rid of our stuff and redo it with these partners? And like, no. We want the heterogeneity of everyone's efforts, but we also want some unified focus that we can measure and see the impact together. So that's kind of the story of the Be Well structure. And there is some concrete stuff that's coming out of it, some tangible infrastructure, and this is going to link back to some of Jason's efforts. But we need a navigation system on the front end. In Orange County right now, there's 18 or more different phone lines for things mental health related. Every single one of them is well intended. Every single one of them is run by great people, but the community doesn't know who to call for when or what reason, so they call 911 because that's a surefire response, and then we see what happens. So we need to reunify those in the same way that Amazon, good, bad, and ugly, but just objectively, is 8,000 things behind the scenes, but they've made it really easy to go to one website and click, and I can get a couch or shoes on my front door tomorrow or today. We should be able to do the same thing for mental health. And if we did that well, we're looking and emulating at other communities, we could solve for a whole bunch of crises just by way of better access through a simplified navigation system. That needs to link to a mobile response, Let's relieve our brothers and sisters of law enforcement who were never engineered to solve these problems and get mental health providers out into community. We're doing that together as a community. In fact, we're live in Irvine right now, and UCI is talking with us about doing a mobile program for this school because you have your own police department and they're looking for relief from these challenges. And then that would link to the campuses of care, where we need to create campuses of mental health and substance use care that's available to everybody regardless of your insurance status, and we need more bed capacity. And so we've built one of those in Orange together with the county, Cal Optima, and several hospitals, and we're en route to doing another one in Irvine, not far from here, which we're really excited about. The dovetail into Jason, UCI, and the program is that this whole thing needs to be undergirded and supported by a broadening network of providers. And so we need high caliber training of amazing psychologists, and that's what Jason is running. And we also need to broaden the definition of what constitutes a provider in community. And so can we leverage promotoras? Can we leverage certified drug and alcohol counselors? Can we leverage mental health workers in ways that we haven't been? And I want to call out Ronnie and the county because they're doing an awesome job of promoting that both within and across the community, that these are legitimate partners in a legitimate way of accessing care. So that's kind of the gist of what Be Well is doing, and the way the community is trying to come together to do things together, less so in a siloed way. I think that's probably good for now.
Yeah.
There's pictures and stuff, but you got the gist.
Yeah, great stuff. And so, just to move forward, I want to leave some time to talk, but look at all this great stuff. So next time. So
Next time.
I just a couple of thoughts. I want to introduce the clinical psychology program at UCI, but also the power of the entire department of psychological science at UCI. So we have just recently started a clinical training program at UCI, so the first of its kind at this university, where we are preparing the next generation of leaders in mental health to go out and not just provide therapy, but rather to become leaders. And that's the main emphasis of our training program. Here's our mission statement. Our program will lead the search for new knowledge and assessment, understanding, prevention, and treatment for psychological disorders and mental health concerns from an inclusive perspective that is psychologically, ecologically, socially, and biologically informed. In this service, we will train clinical scientists to produce, implement, evaluate, and disseminate psychological science and to function as leaders in academic, research, and applied settings to improve the human condition from an inclusive lens. And the power behind the work of the students is really driven by the power of their mentors, the faculty members. So this is a picture of the engine of the clinical science program here, my colleagues at UCI. And also, we have faculty members who are not in the clinical program. So, for instance, Beth Loftus is up there in there somewhere. Raise your hand, Beth. So we have Beth Loftus here who's come to join us. Any other faculty? Stephen, as a clinical faculty member, is here. Anyone else? Am I forgetting? And Diane is our fearless department leader. So we're grateful for you to be here as well. But we are doing things with and in collaboration with the community to create solutions. We're bringing our science forward to make a difference and make an impact. From Jesse Borelli working on relationships among kids, Dan Nation improving the understanding of dementia and vascularity and physical health, Kate Coleman, depression and among young children, and Stephen, who's here. Raise your hand, Stephen. Hey, Stephen. Stephen is improving access to effective mental health treatments by leveraging technology to improve access to service, among many other things that he's doing that are very practical and tangible and felt in the community. I'm so proud to have you as a friend and colleague. Ray Navaco and Julian Thayer doing great work as well. If any of these things resonate with you or you want to reach out to them, I can help facilitate a connection. Allison Zalta focuses on trauma, and Naomi Tabak is our most recent hire who is directing our training for our new therapists who are therapists and researchers. So evidence-based care. Susan Charles, our past chair, studies development across the lifespan. And Elizabeth Martin and I work very closely together on preventing mental health concerns before they become too serious. And this is my work. I'm passionate about finding folks who might be on a trajectory towards developing serious mental health concerns related to psychosis. Because if we can find those folks, these vulnerable brothers and sisters and siblings, before they develop these mental health concerns, we might be able to alter their trajectories in really positive ways, allowing them to live a life of their choosing and a life in the community. And all of the work from all of my colleagues is centered around helping people in these ways. Now, we do this with a partnership of students. Now, this is a picture of students in our clinical PhD program. This is all of them. We have a very selective group of students here. These 17 people represent the best of 700 people who applied from across the nation. We also have other students. We have undergrads and postbacks here. Raise your hands. That are contributing to solutions as School of Social Ecology majors and members of our department as well. So we are creating not just a workforce, but a leadership team, a team that thinks deeply about solutions and systems, that outreaches to the community, generates new ideas, and provides direction and leadership for the kinds of things that Marshall's bringing into the world. So that's our remarks. Thank you so much for listening and paying attention, and we're eager to hear if anyone has any questions or thoughts or ideas to bring the conversation to another level. Yeah, please. Yeah, no, microphone, Krista, if there's a...
Thank you. Oh, good. My name is Krista. I'm actually an alum of what it used to be psychology and social behavior here at in the School of Social Ecology. I'm a licensed clinical social worker, and one of the things I loved about social ecology is that it looks at the complex. I loved being in the school and being part of like urban planning, looking at social work, looking at all of these things. So I always like to encourage that social work has a really good place from social ecology, and it was a really good mashing of things together because I do like to look at all of the complex things. I think that silos is one of the worst things that we have to deal with, and the more that we meet together, have social workers at the table, have different people from these different disparate organizations. I'm an entrepreneur, but I'm also a crisis social worker for the county. And so we have like these different ways of looking at things and all of the different perspectives, and we need to keep coming to the table together.
Thank you, Krista. Yeah. Thank you. Thanks for those remarks, but also thank you for what you do and the importance of your discipline as well as being really sort of the engine of mental wellness for our community. It's excellent. Yeah. Thank you.
I love that presentation and just the way you two did it. It was terrific. My question, I think, is for Jason. You showed a picture of the, I guess, first 2 years of admittees into the clinical program, and an overwhelming percentage of them were women. And I could speculate that maybe that's going on everywhere in lots of clinical programs. And while you talked earlier about teenage girls being at special risk and maybe they might want to see women, is there not a need for male therapists? And is that a concern to you?
Thank you. Yeah, I mean, I think I'm thinking about like literature on like matching therapists with like demographics of their clients. And there is some evidence to suggest, at least in terms of initial engagement, having a therapist that represents similar backgrounds as yourself and demographic characteristics will create an initial connection that will get you back to the second session. So there is a lack of men in psychology, and it's been going on for many years. And yeah, I think that does concern me on some levels, but at the same time, another thing that's sort of like related to that concerns me is that leadership is still more male-dominated. So systems need to be broken down such that there's like parity at every level, and that the mental health workforce is reflective of society, whether, and it's not just gender, but also race or economic class and the like, so that the mental health workforce more represents the population at large. I think that would be an aspirational approach. Thank you. Yeah. You got it.
Hi. I heard you said about silo, but as someone who, seek for therapist or whatever, I'm actually looking for someone who very specialized, because I work for UCI. I have very good insurance. We even have the EAP that allow you to have like 3 free sessions. I have a PhD in psychology. I still hesitate to seek for help for the stigma associated with it. I feel like if I'm strong enough, I should be able to handle this. Why would I need help? I had a health crisis in 2021. And then that's very stressful. And then I went to my doctor at UCI Health and say, I think I want to see a psychologist who specialized in helping people who have been all of a sudden diagnosed with a health crisis.
Yeah.
They couldn't find anybody. They refer me to palliative care. I'm like, what? I saw those are for people who are dying. I'm not dying. And why do you refer me to there? And so it's like, that's the only thing we have. So I went there. They have 3 people sit with me, talking for an hour. At the end, they're like, we couldn't afford you what you were looking for. So, and also you can tell English is not my first language. So I am actually looking for someone not only who specializes in treating people. I mean, I don't even think I need treatment. I just need to sort out when you are diagnosed with cancer at such an early age, like, why? Why me?
Yeah.
I'm such,
Yeah.
and someone who can speak my language and understand my culture.
Yeah. If you want, 2 things come to mind. One specific to your situation. If you want to take a minute afterwards, there's some ideas that we can explore around finding you the right help. I think you highlight a really important challenge that is systemic, and it is the silos. In the situation you just described, there's a lack of providers with the specialty that you're seeking, a lack of providers with the cultural and linguistic sensitivity that you're seeking, and there isn't a system that sensitively holds your hand and connects you to that provider. And so you're lost in the abyss, searching around for this door, and then this door, and then this door, and your situation is replicated times 1,000 every day across Orange County. Because just like you, right now, somebody who's Spanish-speaking, non-English, just found a syringe in her son's room and has no idea what that is or what to do. And so she just made 15 calls to try to access the right care. That's the kind of the fragmentation that we're talking about in that image. There's a whole bunch of people that could help that mom, and there's some people that can help you too, and I've got some ideas and we can talk after. But we don't have the structure where there's a single point of contact and then a friendly, sensitive ushering to where you get your needs met. And it's unacceptable, because these types of challenges, first and foremost, impact our ability to assess, perceive, and navigate. I mean, that's fundamental to mental health challenges. And so it's sort of salt in the wound. So thanks for highlighting that. Yeah.
Navigator.
Yeah.
Yeah.
Yeah, thanks for highlighting that challenge.
I think many of us, even my own story with my daughter, share the same challenges. And what you were saying. It just hits the nail on the head. And probably something that many of us can relate to. And so we're grateful that you dedicated your morning to this and to sharing these ideas with us. And hopefully this will stimulate more conversation and more connections in our ability to make inroads in what is really a crisis, but a crisis with solutions that our fearless leader might be able to help guide us towards. So thank you, John.
Thanks, John. Okay, thanks.
What an inspiring conversation. Listening to the two of them, I think, gives us all hope. And one of the things that I think we all know, because you wouldn't be here today if you didn't already understand this, one of the things they pointed out is this mental health crisis applies to all of us, with 40% of Americans suffering in some way. This isn't about someone else. This is about a family member. This is about a friend. This is about a colleague. This is about all of us. And to address it, we need novel approaches. We need approaches like Be Well OC. We need approaches like the clinical program in psychology here. One of the things I didn't mention to Marshall is I was up in Vancouver a couple. I am using.
Wait. We just got to turn on. Try now.
All right, there we go. Wow. I usually think of myself as having a very loud voice, but apparently not as loud. So what I was saying was that this is a problem that really affects all of us. This isn't an other person's problem. This is a problem that affects us, our family, our friends, our coworkers, and it really requires a response that is novel and brings together a lot of organizations. Approaches like Be Well OC, like the new clinical program in psychological sciences. And what I was about to say is that I hadn't told Marshall that I was up in Vancouver a few weeks ago. And I was saying that I was from Orange County, and they said, oh, you have that new approach down there where instead of sending a police officer out to a situation where there's someone who's having a mental health challenge, you send a psychologist or social worker. And I said, as a matter of fact, I know exactly the guy responsible for that. So well done.
Thanks.
And we are training the next generation of therapists, researchers, and activists who will be addressing these problems here at UCI. One of the great opportunities I have as dean is being able to interact with folks like this and to see the work they do. And it is with great pride that the School of Social Ecology has alumni like Marshall and faculty like Jason and the students we have here. And I hope that all of you who've come here today will remain partners with us in trying to address these problems. We are committed to not just studying social problems, we are also here to help solve them, and we are here to solve them in partnership with such wonderful people as Marshall and Jason. So I will hope you will join me in thanking the two of them for an invigorating, inspiring, hopeful presentation this morning. And it gives us our marching orders as we go out today of what we all need to do together. So thank you both very much.
Thanks, John. Thanks.
And thank you all for showing up today. We will look forward to seeing you, we hope, in April. Pick up the little brochure, or the little thing on your table. We'll have a little more fun with the name of the school then. Right now, though, again, thank you for coming today. I'm sure the two of them will stay around for a couple more minutes if you have questions.
Sure.
Have a good day.
Thanks, John.